A new Chinese coronavirus has infected thousands since the outbreak started in December in Wuhan, China. Scientist Leo Poon, who decoded the virus for the very first time, believes it probably started in an animal and spread to humans. Corona means crown, so when viewed under an electron microscope, these viruses look crown-shaped, said Bhanu Sud, MD, an infectious disease specialist at St. Jude Medical Center in Placentia, California. Where does this virus came from? Because the virus first appeared in Wuhan to people who had visited a local market for seafood and livestock, authorities could only say it probably jumped from an animal to humans. Potential sources of the new coronavirus, informally referred to as 2019 nCoV, are two snake species, the Chinese kite and the Chinese cobra, the conversation states. Researchers in China have analyzed the virus' RNA genome and found evidence that it is a combination of a coronavirus bat and an unknown coronavirus that may originate from one of the snake species. Symptoms of coronavirus. The viruses may cause people to become sick, usually with a mild to moderate disease of the upper respiratory tract, similar to a common cold. Symptoms of coronavirus include a runny nose, cough, sore throat, possibly a headache and possibly a fever that can last for a few days. Before that, did you ever heard of MERS, or SARS virus? Respiratory syndrome in the Middle East, also known as the MERS virus, was first identified in 2012 and also causes respiratory problems, but these symptoms are much more severe. According to CDC, 3 to 4 out of every 10 MERS-infected patients died. The other coronavirus that can cause more severe symptoms is the severe acute respiratory syndrome, also known as the SARS. Initially reported in southern China's Guangdong province, according to the WHO, it causes breathing problems but can also cause diarrhea, exhaustion, shortness of breath, respiratory distress and kidney failure. Depending on the age of the patient, the mortality rate with SARS ranged from 0 to 50% of cases, with the most affected being older people. Apparently, the Wuhan coronavirus is thought to be milder than SARS and MERS, and symptoms take longer to develop. How it spreads. Viruses can spread out in animals from human contact. According to the WHO, scientists think MERS had originated in camels. But for SARS, scientists said it were to blame alleged civet cats. But authorities have not yet verified what animal may have caused the current outbreak in Wuhan for this coronavirus. A cough, sneeze or handshake may cause infection, depending on how virulent the virus is. Touching something an infected person has touched and then touching the mouth, nose or eyes can also transmit the virus. For the Wuhan coronavirus, human-to-human transmission has been confirmed, but researchers are now trying to understand who is transmitting it most, who is at the greatest risk and whether transmission happens mostly in hospitals or in the population. With example, SARS and MERS have been mostly transmitted inside hospitals, Horby said. How can you prevent it? There is no vaccine to protect against this family of viruses, at least not yet. The U.S. National Institutes of Health is working on a vaccine against the new virus, but it will take months for clinical trials to begin and more than a year for it to become available. By avoiding people who are sick, you can reduce your risk of infection. Avoid touching your eyes, nose and mouth. Wash your hands with soap and water regularly, for at least 20 seconds. If you cough or sneeze, cover your mouth and nose and clean the objects and surfaces that you touch. If you're going to China, be mindful of the symptoms and avoid the live animal markets, where the new outbreak started in Wuhan. Also, use hand sanitizer and wear face mask if experiencing flu-like symptoms. Take care of your health. That's the only thing you've got to live.